So welcome. Thank you, Hannah, for offering to do this session, because I think it's quite an important session to do mental health. And I think we talk about mental health sort of postpartum quite a lot, but I know that I haven't heard much about mental health during pregnancy. So I think it's quite an important one to talk about, because I don't think it gets talked about as much. So I'm just going to go through a couple of slides just to introduce myself and introduce Hannah, and then I'll just open it out to you guys if you have any questions that you want to ask Hannah. So just to say, if you have any medical concerns about your pregnancy, to speak to your midwife or your GP. This session is not a replacement for professional medical advice. And like I said, this is being recorded. So if you do want to ask a question anonymously, you can drop it in the chat and I can ask on your behalf. So just for the benefit of anybody who doesn't know who I am, I'm Erin, and I'm a mum of 3. I've got 2 girls who are 5 and almost 8 in a week and a half, I think, and a 1-year-old little boy. And I've had very different births, 3 very different births, and I've been on a kind of quite a journey with my births. I had quite a medicalised birth first time round. With hindsight, should have done lots of things differently and didn't really know any different. And then as I've gone through my 2nd and 3rd births, learned a lot more about hypnobirthing and that kind of optimal environment for birth and birth choices and lots of different things. And the hypnobirthing particularly made such a big difference to me and my birth experience that I decided to retrain and change careers and become hypnobirthing instructor. So I teach hypnobirthing in Bromley, and I cover Bromley in southeast London. So that's a little bit about me. Hannah, do you want to introduce yourself?
Of course, yeah. So I'm Hannah. I am also a hypnobirthing teacher. That's how I know Erin. And I've also worked in mental health for the past, trying to work it out there, I think it's about 6 years. So initially I was in the management team at a national perinatal mental health charity, and then I started working in a mental health unit for a little while, and then I went on to train as a midwife, and I've now been qualified as a midwife for a year, which has flown by. And I've just sort of this year, lockdown has really inspired me to do some extra qualifications in perinatal mental health. So I have done my training in postnatal depression, perinatal anxiety, birth reflections, and I'm just about to start on birth trauma. So doing quite a lot, but all of this information that I'm going to share today, it does sort of relate just generally to mental health. It doesn't need to be pregnancy or postnatal specific. So you can take it and use it in your day-to-day life if you need to, with any family and friends or yourself.
Right, I'm going to get rid of the slides. Okay. Does anybody have a question that you want to ask Hannah initially?
Not well, I have a list, but
go through it. It's perfect. I like someone that's prepared.
I think one of the things I kind of look to when I look towards pregnancy and hopefully very soon, I think the biggest thing I almost fear is that moment of inevitability, where the second that you're pregnant or throughout pregnancy, I'm sure as you're getting closer and closer to your due date, that sense of change is coming. So I know when you're trying to get pregnant, that's what you're opting for, that's what you're going in for, but that sense that you might never come back to who you are. And I just wondered if that's something that you see a lot with the people that you work with, and is that common? This kind of feeling that you're going towards something and you're a bit scared that you're not really going to feel like yourself ever again.
Yeah, I think that's definitely a really common feeling, and you even see it with people who are trying to conceive. So you might even be relating to that a bit now, that as soon as you do get pregnant, even if it is really early on, you're never going to go back to who you were before that point as well. So it does start quite early on in your journey, and as you go through it, you can experience all of these emotions, and some are, you know, as you say, some are good emotions that you're excited for it, you're anticipating your baby, but other parts of it are a bit overwhelming and negative, and that might be that you are worried about how your relationships are going to change, or how your body is going to change, how your social life is going to change. Just everything really is going to be different, isn't it? But I think it depends how you look at it. You can look at it really negatively and think, I'm never going to be what I was like, you know, last year or 5 years ago. Or you can look at it as a really good change, and the fact that you're starting this new journey and this new stage of your life that is actually quite long awaited. So it is really, really common to feel those things. It's normal. So don't feel like it's not a normal thing. Probably everybody will experience them to some extent. So don't be concerned that it's just you. It's totally not. But at the same time, if you are feeling those things, make sure that you do speak to somebody about them, whether it's just your other half or your friends who have had babies themselves, or just somebody completely independent to that. Make sure that you're speaking to them, because it's sometimes nice to know that somebody relates to you, isn't it?
Yeah, definitely, because you feel guilty otherwise, don't you, that you're
Yeah,
got the opportunity for something really amazing about to happen, and then
yeah,
there's a little kind of bit in the back of your mind just saying, oh, but, and that but is,
yeah.
I think
Erin, would you say you feel that as well?
yeah, definitely. I think it's really, really common. I know with each of the children that I've had, I've felt that kind of a period of kind of loss of identity, because you do become mum, and it can become all consuming, and you kind of do forget who you were beforehand. I mean, the only thing that I would say is that things do change, and as babies grow and they become their own little people and they develop and they rely on you less, you get that flexibility to be able to put more time and invest more time in yourself, and that is really important, I think, to be able to have that time to kind of really find yourself again after, you know, jumping into parenthood and becoming mum and losing that sense of self. It is really important that you do give yourself some time for me time, you know, which is harder at the beginning when baby is little. But like we were saying about things like postnatal doulas and things, I mean, even if it is just paying for help in the early days, and having, you know, 10 minutes even to go and have a shower and to just sit with yourself and have some me time. Doesn't matter how much time you get, as long as you set some aside every day, I think is really, really important. But it is completely normal to feel like that. And I think a lot of people that get pregnant, they feel guilt, you know, for you know, for feeling that way, or for feeling worried about how they're going to cope, or feeling worried about whether, you know, because it's like you say, it's something that you really, really wanted, and when you finally get it and you get pregnant and then you start doubting things, or you feel anxious about things, you can feel guilty about it. But also I think it's entirely normal, and I would say don't beat yourself up over it, because I think you have to kind of sit those feelings and acknowledge them, and not beat yourself up about feeling that way. Does that kind of answer that question?
It does, yeah. It's say, just knowing that at least somebody else has that same thing of, whilst it's really exciting, I say, even before even, you know, I've even gotten pregnant, just even kind of being on that journey towards pregnancy, hopefully. Yeah, just already having that fear of, like you say, losing who you are and just being mum. And
yeah,
even those moments that I have at the moment where I just maybe I've sat down and watched a half-hour program and I haven't been disturbed, and you sit there and go, gosh, I may never get to do this again, or not for a very long time. And it's those little moments that kind of, yeah on you.
But then it's a payoff, because you might lose some of those kind of freedom, the freedom to be able to watch a whole TV show, for example, but then you get all these amazing moments with your baby that which are much more amazing than getting to watch a whole film in one go. It took me 3 days to watch a film the other day. But I wouldn't change it, because I got baby snuggles instead, so it was fine. What was the next question on your list? Did you have another one that you wanted to ask?
I do have several. From your experience, I mean, both of you, but what is the most overlooked cause of mental health is in pregnancy? What's something essentially to look out for that I may not anticipate is a concern?
I think a lot of people just think of the common, you'd be feeling a bit down or a bit stressed. That's generally what people consider to be a mental health concern, isn't it? When you feel depressed or you feel anxious, but actually there can be so many more things in pregnancy, such as not feeling any connection with your baby, or starting to do things that maybe you wouldn't have anticipated you ever do, like getting a bit obsessive over cleaning and worrying that if you don't do something, then something will happen to your baby. That's more sort of OCD behaviours, so they can be quite common as well. Or actually not looking after yourself at all, which obviously is not good in pregnancy, because you're having to provide for your baby as well. But some people, they stop eating, they stop drinking, they stop getting out of bed, they can't sleep, they don't want to just in general care for themselves, they don't want to wash. So I know that sounds quite extreme, but at times you might feel that, especially in the first trimester, when you might be feeling quite rough, and you might just put it down to feeling rough, but actually you can get yourself in quite a deep dark hole at that point. If you really are feeling unwell, you can get yourself quite depressed. And then again, later on in your pregnancy, again, you don't want to do anything, you stop enjoying the things that you always liked doing before. So they are the key signs. Also getting a bit snappy and agitated are also really common signs that there might be a mental health problem, if your relationships just aren't the same, or you just aren't communicating properly with people. So they're all things to look out for. And again, it's really common, because I think the statistics at the moment say that 1 in 8 people will experience a mental health problem in pregnancy, but I would suspect that it's far more than that. So in the general population, it is 1 in 4, and probably even more again. So most people are going to experience those symptoms. It doesn't necessarily mean it's a mental health problem. I think that's quite the misconception, that people will say, oh, they've got a mental health problem if they're just feeling a bit low or down, but actually it's only a problem if it is affecting your day-to-day life for a prolonged period of time. If it's just a one-off day, then it's probably just a bad day. But if it is affecting you for more than 2 weeks at a time, then that's when you really need to start reaching out and seeking support. And that can be the hardest part, because especially when we're pregnant, we have all of these thoughts that, what if they think I'm a bad mum, or what if they're going to take my baby away if I admit to feeling this way? And that's so rare, because nobody wants you to be separated from your baby at all. They're only going to do that if they think that you are a danger to yourself or your baby, which is really, really, really rare. But it's these thoughts that we have, and you might think at the moment, oh, that's stupid, I wouldn't think something like that. But actually, when you are pregnant, these thoughts become so much more real. And as Erin said, your identity becomes mum, and that's all you can think about. And the thought of your baby being taken away, however rational or not rational that is at the time, it can be really damaging, and it can feel really real. So just keep an eye on the thoughts that you're having and how they're making you physically feel during your pregnancy. So you may or may not get the thinking pattern of mental health problem. You may or may not get the physical symptoms, such as, you know, the racing heart rate and feeling tired, feeling dizzy, panicking. But just make sure you keep an eye on it. And you might not necessarily identify these symptoms or these feelings. It's probably going to be the people that are closest to you that actually see that something's not right and that you're not how you usually are. So just make them aware as well that mental health concerns are really common in pregnancy, and it's not anything to be ashamed of, but you need the support around you in pregnancy more than ever, because you're so vulnerable at that point and after your baby's born, obviously. Does that answer your question?
Yeah, actually, it brought in some things I hadn't even thought of before. You know, not having a connection to a baby, just automatically knew that that's going to be something that's a given. But yeah, I hadn't really even thought that, like you said, something to look out for. Or...
Yeah, and you know, that not having that connection with your baby, it's not necessarily that something's wrong, because to begin with, it can be quite difficult to, especially in the early days when you're not feeling the baby move. You're like, is there actually something in there? Is this actually real? And it's sometimes not until they're actually born that you're like, wow, you've actually been growing inside me for the last however long. And you may not feel that connection, but it's when those thoughts turn more negative that there might be a problem, or thinking, actually, I don't like this baby, I don't want them in there, because people do think things like that. And again, it's not a reflection on them, it's just that there is a mental health concern, or they've had a negative experience in their life that's triggering in their pregnancy. So again, it doesn't reflect on you, it's just one of these feelings that we can't actually do anything about. And it's the same with a lot of the thoughts that we have just day to day. They just come into our head, and they might be totally random, and we might not know why we're thinking it. It's not a reflection on you, it's just that there is something deeper down causing it, but we need to work out what is the problem here. So yeah, just keep an eye on your thoughts, because they tell us a lot. Don't just disregard anything that you're thinking.
Thank you.
Anything to add, Erin, on that?
No, I think you covered it really well. Maria, did you have any questions you wanted to ask?
I'm not sure if you can hear me now.
Oh yeah, I can hear you now.
Yeah, okay, because I'm wearing headphones. I just turned 13 weeks pregnant. Just had my scan, and it's my first baby as well, like new mom. I'm just concerned about something that was told by a doctor a year ago, and is that my cervix is small, because I had a surgery in 2017. It's called conization, cervical conization. I don't know.
Yeah.
If you were. So because they cut a little bit of my cervix is supposed to be short. But when I had this week, when I had my scan, they told me they measured the cervical length, and they said it was normal. So tomorrow I'm just gonna go to the pre-assessment, and they're gonna let me know if I'm gonna get this surgery. They're gonna do some cervical stitch, I'm just worried about that, to be honest. Of course, I have more and more concerns, but I think it's affecting me to a point that I don't know if it's gonna happen. If it happens, is it good? Is it bad? Because I've read too many things online, and I just don't know what to believe.
Okay.
Yeah, I think any sort of medical procedures that they're suggesting to you, it can be very anxiety provoking, can't it? And it can be very stressful. So the cervical stitch, it's a good procedure to have if they feel that your cervix is a bit shorter, and it usually means that there's less chance of you going into early labour. So it's a good thing to have. So just see what they think next time you go. But in terms of controlling your anxieties about this, they picked it up very early on, so that's really good. That should be reassuring to you. And they're doing something about it, so they're looking after you. They know that potentially there might be an issue, and they'll be following you throughout your whole pregnancy, so you'll be really well supported in terms of that respect. And just for you to just have you're having good self-awareness that actually it is affecting you, and that's one of the most the common problems with mental health, is that people don't have any awareness actually that there might be a problem, and that's when they experience more difficulty. So just you understanding that actually this is stressing me out, what can we do about it, is a really good sign. I don't know if you've ever done any sort of relaxation or breathing techniques or anything like that, but they can be really good for controlling any stressful life events or anything stressful in your pregnancy. So have a good look into relaxation, and of course hypnobirthing could really help with that. But me and Erin could speak for hours about
Did you say there's if I have a shorter cervix, there's less chance I go to early labor, so I'll be late? Or
if you have a shorter cervix, there's more chance that you'll go into early labour. But if they give
chance.
but if they put the stitch, then that sort of prevents it from happening.
Okay. What if the sonographer thinks it's unlikely I'll go through this procedure? It's just the doctor has the last word about it. But what if she says, like, when my cervix was measured and she thinks it's average?
If it's a normal length, then there's not really any higher chance that you'd go into early labour at all. It's likely that you'll have a normal length pregnancy.
Good, thank you.
That's okay.
So if people do have mental health concerns, Hannah, who should they be speaking to, or where should they be looking for support?
I think this is the question, isn't it? This is tricky because we all know that mental health services are very underfunded, and if there are any services or practitioners available, they often don't have a lot of training, especially in pregnancy related conditions. But I suppose the general places to go would be, first off, your midwife, if you should be seeing them quite regularly, so they should always ask about your mental health, whether you feel confident enough to speak up about it. That's the other question, isn't it? Because especially now, when you might be seeing 5 different midwives in your whole pregnancy, unfortunately that is the way that a lot of hospitals are at the moment. You see a lot of different people, and you might not necessarily have the confidence to speak to somebody who literally just met and for the first time. So that can be difficult, but they should always ask you about your mental health. If not, you can speak to your GP, how helpful they'll be again is the question. I think especially in pregnancy, the GPs, they shy away a lot from medication because they don't have the knowledge of how the medications might affect the pregnancy. But there are a lot of antidepressants and anti-anxiety medications that are safe to take in pregnancy, so there are options there in terms of medication. And I know certainly here, I don't know if it's a national thing, but they have to refer you for counselling or CBT, and you have to be seen within 2 weeks if you're pregnant or if you've just had a baby. So that is a good thing that has started recently. So they're sort of the medical practitioners you can speak to, and also your health visitor if you've met them and you're in contact with them, or if you've had your baby, your health visitor can be quite a good place to go to, because they're quite knowledgeable about having a baby and the concerns that you might have. And then there are a few charities which you can go to. So the one that I worked for before was PANDAS, which stands for pre and postnatal depression advice and support, but they deal with more than just depression. They deal with anxiety, birth trauma, OCD, everything. And they've got a helpline, they've got email support, they've got local support groups when they're able to open again. So that's one. And then you've got the more general mental health charities like Mind or the Samaritans. They'll always be willing to listen to you. So there are definitely places to go, but sometimes, especially with your medical professionals, it can take a little bit of work on your behalf to actually get where you want to. And I know that's the last thing that you want to be doing if you're struggling with your mental health. You don't want to be battling to get the support that you need. But if you're not happy with what people are saying to you, then just ask for a second opinion. Make sure they've written on your medical notes what you've asked for, and if they've declined anything, make sure they've written it down, because they're less likely to want to write down things that you've declined. They'll probably just offer it to you instead. They're the best places. And then there are people available privately, so I do a lot of work privately for people in their pregnancies and who have had their babies. And I know there's other people as well, so I'm sure there'd be somebody who is local to you. You can seek counselling or any form of therapy. There's loads of private therapists who are there who can not necessarily do anything medical, but they can certainly listen to how you're feeling. And sometimes that's all you need. You just need somebody to listen without judgment and without interrupting you constantly. So it does depend what support you're looking for, and that can take a bit of working out what you actually need right now. But it's worth it. Just reach out to somebody, and the sooner you can reach out, the better, because ultimately if you do let your mental health deteriorate, it can lead to really devastating consequences, and that's the last thing that anybody wants to happen.
I think that is it, isn't it? It's making that first step to acknowledging that there's an issue and actually taking the step to speak to somebody. And I know from personal experience, I didn't have any mental health issues in pregnancy, but I did have very, very bad postnatal depression after my first baby, and I didn't speak to anybody. And in hindsight, I should have spoken to somebody right at the beginning, and I just battled through and suffered for 12 months. And I think because I kind of felt like I couldn't ask for help, and I didn't know who to ask for help. And like Hannah said, I was worried about, if I ask for help, they're going to think I'm a bad mother, and they're going to think, they're going to put me under a microscope and expect to be tracking what I'm doing all the time. And I just got so paranoid that I just didn't ask for help. And I think if I had have asked for help earlier, I think it would have helped. It would have prevented a lot of the kind of lasting anxiety issues that I personally have. I know that it's not something that has completely gone away for me, because I think because I didn't seek the help, and it has left a mark on me, I think. So I think acknowledging that you need support and speaking to somebody as soon as possible is really, really important. And also, I would say, it's obviously professionals are brilliant to speak to, but if you don't feel comfortable speaking to a professional, even if you've got close family or friends, just opening up to somebody that you feel comfortable opening up to. I had a couple of really, really close friends who had babies first time round the same time as me, and I honestly don't think I would have got through the first year if I didn't have them to speak to. And they were so supportive, and they were always there when I needed to kind of, just vent. That along with my mum really, really helped me, I think, get through that period. But you do need to kind of take that step and acknowledge that you need someone to talk to and speak to somebody about it, because it becomes all consuming, and it can really spiral if you don't speak to somebody.
I think that's the thing as well, especially the postnatal. That's kind of my last question that I had on here, and I know it wasn't related to mental health in pregnancy, but just kind of mental health moving forward into the postnatal period, because that is the thing. Is at that point you're not just thinking of your own mental health and got yourself to look after. You're doing that whilst caring for a little bundle of something who doesn't really know how to navigate the world at all, and hasn't figured out sleep or other bits and bobs yet. So I think it's having those two things. I think I feel confident enough, she says, stage, but confident enough that I can be my own advocate for my own mental health. But obviously I've never had to do that whilst being a mother, so that's a whole different ball game of, like you said, Erin, you didn't have any problems going forward into pregnancy, and then it was afterwards suddenly it's a different kettle of fish.
I think postnatally, I mean, mine was triggered because I had my daughter had severe silent reflux, and she had multiple allergies, so I effectively ended up feeding her for 12 months in a dark room in complete silence, and couldn't leave the house because she just wouldn't feed. It was pretty horrific, and that's definitely what triggered it for me. But again, if I had have asked for help sooner, and if I had had more support, I think it definitely would have changed things. But in hindsight, it's wonderful to look back on something and realize what you should have done, but you just don't know at the time. But you've got massive awareness, you've got fantastic awareness, even before you conceive, having, even joining in this conversation and discussing mental health issues, and being able to identify them and flag them really early is a really, really good thing.
Definitely. I think the other thing is that these issues, they can affect anybody. So you might be sitting there thinking, oh yeah, I've never had any mental health problems before, I don't know anybody who's experienced that before, but actually it may well be you, or it may well be your best friend who has just had their baby, and they appear absolutely fine, but internally they might be going through a massive battle with themselves. So there are things that slightly increase your chances of experiencing a mental health problem. So if you've had one previously, or like if you've had depression before or anything like that, or if your mum or your sister has had a mental health problem in pregnancy or afterwards, you're at a higher chance. If you've had a difficult birth or a difficult pregnancy, or if you've experienced a particularly difficult life event during your pregnancy or previously that might trigger something in pregnancy, you're at a slightly higher chance. And that's exactly the same for after the baby's born. You might have had the best pregnancy, feeling absolutely wonderful, but afterwards it hits you like a ton of bricks, and there might not be any rhyme or reason for it, and it might be due to hormonal imbalances, or it might be due to an environmental problem, or a physical problem. So if you're really struggling with recovery after birth or with breastfeeding, that can cause a lot of trauma, or as Erin says, like the reflux, that must be really quite debilitating if you can't even go out the house without having to really prepare for it. That is going to make you feel all sorts of things, isn't it? So there's a lot that comes into it that might not be totally apparent at this very moment. So really keep that in mind, and it's great that you do have the self-awareness, as Erin says, because the last thing you want is to just be sitting there feeling absolutely terrible, but you don't want to admit that you're feeling terrible, and nobody's noticing that you feel awful because you're putting on this front and you're saying that you're fine, and perhaps the people around you don't have the knowledge of mental health to recognize that you're not fine. That's also one of the biggest problems, is that mental health education is naff, isn't it? And people just expect you to be loving life after you've had your baby, because this is really long awaited for you, and it's the best thing that ever happens in your life, is to have this baby, and then you aren't feeling like it's the best thing that's ever happened. That can be really difficult to admit that. So just look out for the signs, and as Erin says, even if it's just talking to a friend or family member, that is the first step, and then hopefully later on you'll be able to reach out for any medical support if you feel that you need it.
I think there's no shame in taking medication for mental health issues either. I mean, it is one of the reasons why I don't think I asked for help, because I didn't want to take medication, and it did get to the point sort of near the 12-month mark where I did speak to the health visitor, and she did say, I think you should see the GP and get some antidepressants, because I couldn't get out of bed. I was really bad, and I think there's such a stigma attached to medicating for mental health problems, issues, that there's no shame in needing to medicate at all. I think that's a really important thing to kind of to understand, that it's not failing on your part, and it's not something to be ashamed of at all.
Definitely, because what the medication can do is it can give you a bit of your life back, and once you're able to get that that sense of self, or your mood is improving, then you are more likely to be able to speak about how you're feeling and tackle that side of it. And then if it feels right for you, you can gradually come off the medication. I know that I've been there myself, not related to pregnancy or having a baby, but I've been on medication for my mental health, and at first I was a bit like, oh, why would I want to do that? There's nothing wrong with me, it's not going to help me. But actually, when you're on it, you realise how stupid you were before. You just think, actually, why didn't I do this sooner? Because it's changed everything for me. And again, as you say, it's all in hindsight, isn't it? But it does give you that just something back, because you can sometimes just become a shell of a person, and you need to feel, don't you? That's the thing. When you've got a mental health problem, you might not necessarily feel anything, and being on medication, it can just make you be able to do the basic things, like just caring for yourself, which we all take for granted, but actually if you are struggling, you don't want to do anything. So medication can be vital. And again, there are safe things for pregnancy and there's safe things for breastfeeding, because I know that's what worries people the most, is that it's going to affect the baby before or after you've had them, but actually it doesn't. And if you need that support, you also have to outweigh what is more vital here, that I keep my mental health well, or my baby is slightly affected by a medication. Actually, you are the priority always, which is, again, is difficult, isn't it, when you feel like you need to grow and nurture and support your baby in the best way that you possibly can, but you can't do that unless you're well yourself. You just can't care for your baby unless you are at your best, or at a functioning level at least. So that's why medication can be a real lifeline for a lot of people.
Yeah, that's a really positive kind of statement. I'd never really thought of it like that. That's yeah, it's a really good thing to hear.
Good.
Did you have any other questions?
Nope, that's exhausted my list. Thank you.
No. Maria, did you have any other questions you wanted to ask?
Where to get help, like during pregnancy, and yeah, what is the process?
So if you speak up and say you say to your midwife, I'm not feeling too great right now. A lot of hospitals have a specialist mental health midwife who they can refer you to. So, we all know our midwife appointments are about 20 minutes long, and they don't have time to really explore how you feel. So these specialist midwives can spend a bit more time with you and signpost you to different organisations, and also support you in speaking to any doctors and referring you to counselling and things like that. So they have access to a lot of different avenues and information that can be beneficial to you. So that's sort of the first route. If you go via your GP, they may well give you medication, which they can just give you straight up. And usually, I don't know if this is what you have where you live, but we've got Health in Mind here, which is a counselling service, and you can self-refer to them. You can just do it online, so anybody can do that. You don't even need to go and see your GP beforehand, so you can literally just do that yourself, and they'll contact you, and that's just somebody to speak to. And they do some online courses as well, so that could be helpful. And then any charities, you can just email them, send them a message, or give them a call in your own time if you feel like that's the sort of support that you need. So there's always somebody available. It's just having the confidence to make that first contact. Once you've done it the first time, hopefully you'll be more likely to go back and more likely to be a bit more open. But I think it's that not knowing what people are going to say that first time round. I know I've been to the GP just about just any random health concern, and you turn up and they completely dismiss you. That's the last thing you want when you've got a mental health concern and you're being really brave in speaking up about it. So I think that's what worries a lot of people, is that they're going to just be completely dismissed and, I don't know, told they're just pregnant and they're hormonal. That's not what you want. But just make sure, even if it's just writing things down on a bit of paper and taking it to your GP, write down your symptoms, do a little diary for a week, just writing down how you feel each day and things that you've done. If there's a don't want to do, just have a bit of something there to back you up, because sometimes that can give us confidence as well. But I'm sure I can send Erin a list of charities and places to go, and she can send that over to you if that's helpful.
Okay, thank you. Yeah.
Okay.
Do you think it is important throughout pregnancy and after to realize that it is really common to feel these things? And I think social media's got a lot to answer for in terms of presenting this rose-tinted image of pregnancy and the first year after birth. We all share the best bits, don't we? And people don't, especially because we're British as well, we have this stiff upper lip, and we don't like to show, you know, any kind of, you know, negative side of things that are going on in our lives. So it actually is really, really common to experience these things, and we just don't talk about them. So yeah, I think it's important to realize to not beat yourself up if you are having those kind of those feelings, because they are really common and they are really normal. And plus, yeah, you are hormonal throughout pregnancy and after as well, and also sleep deprived throughout pregnancy and afterwards. And that, you know, sleep deprivation has you know, a huge impact on how you feel. You know, I know from personal experience that if you're not sleeping, that can massively affect you. So I think, yeah, just be kind to yourself, and not beat yourself up if you're feeling a certain way, because it probably is a lot more common than you realise. Was there anything else that you wanted to cover, Hannah?
I think we've covered pretty much everything, haven't we? Can't think of anything.
Any other questions before we finish up?
Yeah,
No.
covered more and beyond than I really even thought to ask about, so that's
Oh,
great.
good.
Thank you very much.
Good.
What I'll do is, after this session, Hannah, I'll get back in touch, and if there's any kind of resources and links and websites that you want me to circulate, I'll send those on email, and I'll put them on a blog post at the bottom of the recording as well, so that anybody that's missed this session can access the links as well.
Amazing.
Thank you very much, everybody, for joining, and thank you, Hannah, for your time.
Thank you.
Thank you.
Okay, take care. Good luck.
Bye.
Thanks.
Bye.
Bye.